from the physician saying that we need to place an NG tube because you're having some fluid buildup in your stomach and it's causing your stomach to be distended and very uncomfortable. So first, can you tell me your name and date of birth? Okay, I'm going to verify by the wristband. That is correct. And then can you tell me what year it is? Okay, good. Can you squeeze my hand? All right, and I see that the patient can follow instructions. Have you had any nasal surgeries in the past? Have you ever had an NG tube? Okay, you have. When was that? Do you remember what size tube they used or not? Okay. And so now I'm going to place my gloves on. I'm going to begin my assessment now, okay? Some inflammation in your left nostril. Is that where you had your last NG tube? Yeah, okay, that's what I thought. So I'm probably going to end up using the right one. Can you, well, just breathe normally so I can determine airflow? Okay, your right one does have a better airflow, so that is the one I'm going to use. And now I'm just going to listen to your bowel sounds, starting with the right lower quadrant. Sounds were not present, so it indicates need for the NG tube. And now I'm just going to kind of palpate your stomach, okay? Tell me if you feel any tenderness or pain. I feel that the stomach is distended, so that again reassures that we do need to place an NG tube. Now I'm going to explain the procedure to you, Mr. Smith. Even though you've had one before, I just want to run through it with you. I'm going to be placing this tube. It's going to go down your nose, through your throat, and into your stomach. And if you at all feel like you need to throw up, I will have an emesis basin placed right here for that. I'm going to be giving you water, and as you sip the water, every time you swallow, I'll be placing it further. It might be a little bit just uncomfortable, just so you're aware. Okay. So now I'm going to double check the physician's orders to determine what size tube we need. It might be different than last time, okay? And the physician's orders match the tube that I brought in. So we've got the right one. And now we're going to blow your nose. Alright. Go. Just to make sure the airway is clear. Since my gloves got a little dirty, I'm going to replace them. Grab a towel and place this across your chest. Alright, are you ready to begin? So I'm going to raise the bed up. I'm going to make sure the head of the bed is at about a 45-degree angle. And now I'm going to open up my kit. And I'm going to measure from the nose to the earlobe and down to the which is just about 55. And then I'm going to take a piece of tape and mark that. Alright, and now I'm going to wrap the first 15 centimeters around my finger to try and loosen it. Then I'm going to take my water-soluble lubricant and just lubricate the first 3 inches. Alright, Mr. Smith, now I'm going to begin, okay? So I'm going to insert this in a downward position, and once it's into the mouth, in towards the pharynx, I'm going to have you take a sip of water, and with each swallow, I'll advance it a little further. Another drink. The chevron method. Crisscrossing them. And it's not sticking very well due to the lubricant. Okay, anyways, I would use the chevron method if I have some sticky tape and that would stick, keeping it out of the way. And then I would also pin the tube to the gown. Alright, and now I'm going to get a sample of the fluid. Are you doing okay? Okay, good. I'm going to do about 10 cc's of the fluid. Hooked back up because you're having any difficulty breathing. Okay. Okay. I'm going to be doing the pH test to verify placement, and then I'm also going to call an x-ray and have them come in and verify the placement just to make sure it's in the stomach. And then now that I've got my stomach fluid in my cup, I'm going to take a pH strip. I've got one pH strip. I'm going to dip it, quickly remove it, and tap it on the side. I'm going to match it up, and I see it's at 4, which proves that it is in the right placement because it's acidic with the stomach. And then now I'm going to put my clothes back on. I would perform hand hygiene again. Turn on my suction. Intermittent suction, and then I'm going to unhook this. I'm going to hook my suctioning up. And that will begin the suctioning, okay? I'm going to remove the basin and the towel. And then now that I've got everything settled, I'm going to mark. Since this is coming on tape, I definitely want to make sure you guys are going to mark right on the tube with red. Just that way in case it comes out, they will know that it's lowered. So now I'm going to remove my gloves. I'm going to perform hand hygiene. And I'm just going to listen to the bowel sounds to make sure that it's moving down there. looks good, Mr. Smith. So now I'm going to just make sure the head of the bed is raised to over 30 degrees, which it is, and then I'm going to come back when the doctor says it's okay to take that out, okay? Looks like she needs slipped. So, okay, Mr. Smith. And then now that the physician ordered that the NG tube come out, I'm going to perform hand hygiene. Oh, Mr. Smith, how are you doing? That's good. Looks like there's good news. You're going to get your NG tube out today. So first I'm going to just also try to hear those bowel sounds. And before I get too much further, can you verify your name and birthday for me? Okay, I'm going to double check the wristband, and I see that is correct. And then now I'm going to explain to you what's going to happen. I'm going to put on my gloves. I'm going to take out your NG tube. And during this time, it's important that you take a deep breath and hold that breath. And I promise it's going to be a lot more comfortable than when it went in, okay? So now I'm going to perform hand hygiene. We have a lot of hand hygiene. Gloves. And I'm going to turn off my suctioning. Okay. I'm going to grab my biohazard bag. Towel. Go ahead and unhook the suction now, okay?
One more time recorded. That we have the one more time recorded. Pretend like you're just doing it one more time. Because it gets there. This is a security blanket. You know what you're doing. We take it away.
So I'm going to place this just in case you need it. Alright, I'm going to begin now. And again, you're going to hold your breath until it's completely out, okay? First take this off.
Okay. So you just step like that.
And then I'm going to teach you for when you need to blow.
Are we all going?
Okay.
Well, I gotta go talk to Joey.
Hold your breath. I'm going to pull this out.
And I just reversed.
And I'm going to place it in the towel. And then into my biohazard bag. I'm going to place my biohazard bag into my biohazard bin. And then my towel into the dirty laundry. Here's this if you need to blow. Take my gloves off. Do you feel like you have a sore throat or any difficulty breathing? Okay, good. And now I'm going to I would perform nasal cares and oral cares just to make sure that's all cleaned up in there. And now I'm going to listen to your bowel sounds to make sure that they're moving, okay? Bowel sounds are normal, which is good. That means your bowel, it's still moving even though we took the tube out. And now I am going to make sure that you don't have any more dissension in your stomach. Okay. I'm going to lower the head back down. And then now remember, Mr. Smith, we don't want to place another NG tube in there. So it's important to keep drinking your fluids. That way we can make sure that there's not a whole bunch of fluid buildup and that you won't have any buildup down there. Okay. And now I'm going to, before I leave, I'm going to measure how much fluid was that we collected from the suctioning, and I'm going to drain it out. So it looks like there's about 350 cc's, which was a lot. So now that I've done that, I would perform hand hygiene and make sure everything is cleaned up. Is there anything else I can do for you today, Mr. know if you need anything.